I'm going to start with the ankle. So there's going to be a slight tug right through this ankle mortise joint here. Good.
Yummy.
And the same thing right through here. And drop right through here. Yep. Good.
Yes.
Welcome back, everybody. This is Dr. Brady, and I'm here with Bella, and today we're going over adductor strains. So go ahead and go into your back here for me, Bella, while we talk about it. So Bella, any guesses on the most common sports with this condition?
Soccer.
Soccer's one of them for sure.
Football.
That's one. Yep.
What's that?
MMA is a big one. Any jumping, kicking, planting, and twisting, those are where we see it the most here. With you said your left side has been bothering you here lately. Okay. Is that a chronic condition for you, or is it something that just came up?
Comes and goes.
Comes and goes.
Comes and
Okay.
goes.
Is it coming or is it going right now?
Coming.
It's coming. Okay.
Coming.
Gotcha. All right. So the way we treat this condition here in the office. One, it's a soft tissue injury, so I want to feel the soft tissues, what is irritated, if it's more of an adductor strain, if it's a vastus medialis, or into the quad group, and then also if it's focal to that area, or if we have some hip involvement here. So with you, is it more that adductor groin strain, or is it lateral towards that hip?
A little lateral.
Little lateral, okay. I'm just going to roll this up here, okay?
Go for it.
So go ahead and place your hand right here for me, Bella. Perfect. And then what I'm going to be doing is working this area out here. All right, so this is a pin and stretch technique. So I'm going to have her bend and flex that knee. And then from this position, what I want you to do is drop your leg. And as that's going, I'm stretching that muscle there. So you can do that yourself here as I get traction. Work out that muscle. Now let me know if it's ever too intense here though, okay? Good. And like I said, I'm checking multiple muscles here. I'm going over those adductors.
Whatever that is not happy.
Right there. So once she finds that spot and tells me, like that's intense, I do about 3 to 5 passes over that muscle until I feel it loosen up. And as you can see, I'm using my knee here to really lengthen that muscle, and I'll have her drop it. Good. Just one more for me. Good. Okay. All right. Y'all good?
What was that?
So that was your adductor there.
Take it out.
Adductor magnus.
Take it out.
And then you're saying you also have some lateral pain as well here. Okay, so go into your right side for me, facing that wall over there. So another way, so we attacked the medial compartment here. I did a little bit in the anterior, and now I'm going to work into that posterior or lateral compartment here. So you're going to start in that neutral position, and then you're going to go here and drop your leg down like that.
Okay.
Okay, now I'll be on this side of you. Yep. And lengthen that muscle through there. Good. So again, I'm pinning that muscle down, hooking onto that muscle, and then as she goes down, it lengthens that muscle and right through there, all the way to the hip. Good.
Oi.
And then for video purposes, just one more here for me, Bella.
Yikes.
Okay. And then go into your back here for me. All right, and I like to do that soft tissue work first here because it calms down the muscles that are so tense and guarded to support that joint due to that injury. But before I adjust you, Bella, let me know, is this range of motion okay? Any pain or discomfort at all when I do that with the hip?
Feels good.
Okay, good. Same thing on the other side. Everything fine and dandy over here?
Feeling pretty good.
Okay. Sometimes it's another thing that we look at here. If the injury is over here, depending on the time frame of when you came in, some people wait and see if it gets better. Then they use their opposite leg as more of a compensation form there, and then they develop problems over here. So, but luckily for Bella, you came right in, right?
Right on in.
So I appreciate that, Bella.
Right on in.
All right, so I'm going down the posterior chain here. I'm going to start with the ankle. So there's going to be a slight tug right through this ankle mortise joint here. Good.
Yummy.
And the same thing right through here. Now, if it was really flared up and you could barely walk, I wouldn't do this on the first visit here. So it's patient specific and condition specific. But Bella, you can take it here today.
I got that.
This one's a little bit higher up. It's more that hip joint. Good.
Ooh.
And the same thing over here. Good.
Yes.
All right, perfect. And if I could have you on your side facing me, please.
I suppose.
Awesome. Bella's a good patient. You already know exactly what's going on here. It dropped right through here. Yep. Good. And then the same thing on the other side for me.
Yes.
All right, and then what I would do in this case here, so you saw the ART to the medial, anterior, and lateral compartment here. I would also want to sink some dry needling in those areas here. I'd find those trigger points, and that's where I would insert the needle. That will allow us to go a little bit deeper into the tissue, because no matter how much pressure I use with my thumbs, I'll never be able to achieve that as much as the dry needling there. And then after that, what are we going to do?
Shockwave.
Shockwave therapy, and we'll show you that in the video.
All right, my name is Tanisha. I'm a chiropractic assistant here. I'm going to be doing her shockwave therapy. I'm going to start with some ultrasound gel.
She's already found my trigger points.
Yes, found her trigger points about right in here.
Coming in with the D20 head.
Rub that out a little bit. We go ahead and set the machine up. Do about 8 hertz, 1,000 pulses. Cool, starting out with 1 bar?
Mm-hmm.
All right.
I mean, we'll find out.
So I'm just gonna let this sit right in her trigger point for about 500 pulses, and then I'm gonna switch and find another one.
The groin is weird.
Which head did you use?
I said D20.
D20.
The fat one.
It's not the rubber tipped one.
Not the rubber tipped one. It's the metal tipped
Then I'm
one.
gonna go ahead and find another trigger point. Just gonna use there. And do another 500 pulses.
Beat it up. And as she's angling it, she's getting different trigger points. Such an interesting sensation. It's tender. It's tender.
Yeah. Typically you want your pain to be about a 3 or a 4, nothing above it. If it gets to that point, then we typically make any adjustments needed for the
Adjustments as
patient.
possible.
And you would want to grab a towel, which I did not do, but and wipe the area down. But the whole point of Shockwave is just to send acoustic sound waves to disrupt the dysfunctional tissue so new healthy tissue can grow back.